Hey there, leading ladies. Welcome to the Women Physicians Lead podcast. I'm your host, Dr. Lisa Herbert, a two-time best-selling author, speaker, family physician, and executive leadership coach with over 20 years experience of providing primary care and serving as a healthcare leader. If you are a woman physician ready to make a change in your career and have a seat at the leadership table, then you are in the right place. I'm excited to provide you with the crucial skills you need to be a successful leader and strategies to deal with workplace challenges. So put on your headphones and listen as we explore the new world of building women physician leaders. Hi, leading ladies. It's Dr. Lisa, your coach, your cheerleader, and biggest supporter in your professional and personal development. Leadership is a journey, and today, as part of our self-care series, I'm talking with Dr. Diane Shannon about moving from striving to thriving. So we know as women physicians that we are challenged with not only showing up as our authentic selves in the workplace, but also balancing home and work, dealing with microaggressions, inequality in the workplace, and pay. And also, unfortunately, at times, misconduct by our male colleagues and discrimination based on gender and race. These challenges and continued stressors can lead to depression, anxiety, PTSD, and also burnout, which is one of the things that we're going to talk with Dr. Shannon about today. Ultimately, this burnout can lead us sometimes to leave the medical field prematurely or even cut our hours down part-time. So today, Dr. Diane, who knows all too well the ups and downs of being a female physician, is going to talk to us about moving from striving to thriving. So I want to introduce our guest, Dr. Diane Shannon. She is a primary care physician who made the hard decision to leave practice and pursue a career in medical writing. For 20 years, Dr. Shannon worked with a nonprofit foundation that sought to improve the healthcare system, focusing attention on clinician burnout, lack of reliability, and patient safety issues. Her own personal experience with burnout and her desire to support physicians motivated her to become a certified coach 3 years ago. She now helps physicians escape the riptide of work and home pressures to get clear about what they really want, overcoming barriers, and making changes to vastly improve our personal and professional lives. So without further ado, I am going to introduce to you Dr. Diane. Thank you, Dr. Diane, for joining us. It's a pleasure to have you on the Women Physicians Lead podcast.
Thank you so much, Dr. Lisa. It is a pleasure to be here.
Absolutely. So I am really looking forward to this discussion because, as you know, burnout is a huge issue among women physicians. And now more than ever, we are really experiencing, I think, the brunt of, what burnout can really cause and how it shows up, especially with us being involved in this pandemic. So some statistics I just want to share. 61% of physicians have reported experiencing burnout in 2021. And this is up from 40% in 2018. So this is a huge jump. And this is according to a small survey that the Physicians Foundation had released back in August. More concerning is that 69% of female physicians reported feeling burnt out compared to 57% of male physicians. And we already know that 40% of women physicians either go part-time or they leave medicine altogether within 6 years of completing their residency. And burnout is cited as one of those reasons. So it really becomes important for us to, really start to talk about burnout, what it looks like, and how we can really help women physicians, to sort of hopefully prevent it. But if we do find ourselves in the throes of it, to really, sort of come out of it thriving. So just, give us a little bit of background about, I read a little bit about your bio, but give us a little bit about your background in terms of your career and your journey to now becoming a certified coach, and what was instrumental and maybe who might have been instrumental in helping you make that decision.
Sure. Well, Dr. Lisa, there are a number of things that played in to my decision to finally become a certified coach at this point. I was in primary care And I actually loved being a physician. And one of the things that the people that brought me into my career was my mother, who was a midwife. And I was able to shadow her at times with her patients. And she had her independent birth center, completely natural childbirth, amazing experiences. And I was like, that's what I want. Seeing that incredible connection, that healing connection between the care provider and the patient or client and the family, the whole family would be there. And so I went to medical school. I trained in primary care. And I found pretty quickly in the clinical years that it didn't look like what I had hoped it would look like, especially in terms of that relationship being protected, that the healthcare system would surround and protect that healing relationship. In addition, what I saw was a lot of what I now know are patient safety issues. So places where the system is not set up to be automatic to, protect patients and also to protect healthcare workers, right? So there were these places where I would see, I know that there's something that could happen, but I couldn't protect all of my patients, right? It's too much, right? And so I think, honestly, looking back, that was part of what led to my burnout, was just that sense of the system is not set up in a way that I think it's going to be reliable, and patients can get hurt, and sometimes that does happen. And we know, from the reports that came out in 1999 and 2001, that there are medical errors that happen, and these are not caused by individuals. These are system issues. So with that approach or with that perspective, I did find myself burned out after only 3 years in primary care. And
Wow.
It took me a while to make the decision to leave because, the worst of my burnout was actually in residency, but I didn't see a light at the end of the tunnel, right? So I finally said, this is just not working, and I need to find a life that's going to work for me. And so I did make that transition. I moved into healthcare writing. I actually worked at a number of different nonprofits that were all focused on improving the healthcare system. And I learned so much about the system itself, and therefore my understanding of what drives burnout really grew. And I was able to work with another physician and write a book in 2016 on preventing physician burnout. And as part of that, what we really saw was how much this is driven by the system. And yes, the individual does play a role, and there's a lot individuals can do to mitigate, some of the stresses. But really, the reality of the situation and the way it's defined, the original researchers who were looking at burnout in professionals defined it as excessive stress in the workplace.
Absolutely. I think you hit so many points, basically talking about sort of like the origin really of burnout, right?
Mm-hmm.
And a lot of it, like you said, does come from the workplace. So some people will call it a stressful workplace or toxic workplace, or, a workplace where you just feel like you can't make a difference, right? And for us as physicians who, that's really what we do is we help people, right? We solve problems. So when a problem can't be solved, it just creates, I think, more stress.
Exactly.
And then that stress starts to mount, especially when, you find that you really can't do much about it, or you feel like you don't have the control to do anything about it, can really lead to, definitely the state of burnout. So I agree with you 100%. So for you, being this advocate and being this person now who really is championing, trying to prevent physician burnout, what does that look like for you in terms of what you do now, like your day to day when you're helping your clients, and who are those clients that you're helping, and what are you helping them to solve?
Yes. So a lot of my advocacy work is from writing, the writing that I do. I continue to write. I have a blog where I talk about some of the system issues, and then also individual, like where the individual has agency. And in my presentations, that's a lot of what I focus on, is that interface, because the reality is, yes, there are system issues, and also there are things that individuals can do that when they take that on and really engage, that can have a huge difference in what their daily life feels like, what their experience is like at work and at home. And I work with physicians both individually and one-on-one. I also work with other healthcare professionals, so midwives and nurse practitioners, physician assistants. And since the pandemic, I've really focused more on women physicians. And during the pandemic, I spent some of the time interviewing women across the country, women physicians, and asked them about their challenges. And it was really eye-opening in terms of the commonality of experience. And when I shared that back with them, they were not surprised, and yet they felt validated.
Right.
You know, and so some of the top challenges that came up were work-life balance. That was a big one. Some of the motherhood penalties. So the policies that are in place that actually make it hard to be a parent and a physician, especially a parent of young children. And so those were some of probably the most common challenges that they reported. And they had some great, ideas for solutions as well. And I was so grateful that they were able to open up and share with me what their life experience was really like. And again, there was such a sense of validation, and so many said, I thought it was my fault that I couldn't make this work, right? Mm-hmm. The work-life balance, or the juggling everything, or the guilt about I'm at work, but I feel guilty I'm not at home, and vice versa. And they'd say, I really thought it was it was because I wasn't trying hard enough, or I wasn't, hadn't found the right combination. But then when they heard like all of these women saying the same thing, unfortunately, a number of them also shared experiences of sexual harassment, assault even. I mean, it really was very disturbing to hear how much that is happening.
Yeah, absolutely. Yeah. And I think that, these stressors, unfortunately, sometimes women experience one or more of them. Yes. So just imagine, if you've had to deal with the work-life balance issue, the motherhood issue, then being discriminated at work, or having to deal with sexual harassment and misconduct. I mean, that's a lot to bear. That's a huge burden to carry. Yeah. And then to feel again like it's your fault, like, maybe I should have done something differently, or maybe I should, to feel like that weight on your shoulder of that it's your fault, just really compounds, I think, the issue of burnout. So
definitely. And that was my experience too. I actually, when I was doing the healthcare writing all those years, I was also carrying the shame about leaving medicine, shame that I'd burned out. And it wasn't until I was working with a coach after my divorce who said to me, Diane, why have you never shared your story about this, right? This could help somebody. And my first response was, absolutely not. Why would I do that? Right.
Right.
But in time, she helped me to understand and to reframe it for myself that this was an act of courage to leave something that wasn't working. And I can do a lot more in the world and give more back from where I am now in a healthy, balanced place and a life that's working for me than I could have if I'd continued.
Yes. And we are so grateful that you are here and sharing your story, because it can help so many women. Like I was sharing with you earlier, I experienced burnout myself as well. Mm-hmm. So I know all too well what it's like to feel, like you said, that shame, like you're by yourself, and just a feeling sometimes of just not seeing the light at the end of the tunnel, like feeling like things are hopeless, like you don't really know what your next step is going to be. So being able to share that you did really cross, those barriers, and that you have come out on the other side, mm-hmm. Healthy and thriving, is wonderful. So when you talk about burnout, whether you do that, in your writing or on podcasts, how do you really define it? I think you mentioned, it definitely being sort of cultivated in the workplace, mm-hmm. but how do you define burnout, or how do you get women to see that this is maybe where they are currently, that they may be experiencing burnout?
Well, I think it's helpful to differentiate between, we often use the term burnout in a kind of informal way. And then there's the definition of burnout that was, used initially by those researchers back in the 1970s who were beginning to investigate this. And that definition includes three components: emotional exhaustion, so just being completely spent, like nothing left to give. The second is depersonalization, so really feeling a divide between your feelings around work. And what's interesting is that is actually a coping mechanism for dealing with the emotional exhaustion, right? Yep. In physicians, that can show up as cynicism or kind of treating or thinking about the patient as a case or a number. So it was really eye-opening for me to learn that actually that's a way that people cope, right? And then the third component is inefficacy, which is a sense of, kind of no matter what you do, it's not really going to help. And it's like a low valuing or devaluing what you're able to do as a physician. And so that's the technical definition. And that can be helpful. And especially in research, it's important that everybody's talking about the same thing. But I think there's so much on the spectrum between that and not and thriving. And so we don't want to just say, okay, if you meet this definition, then, do something. There's this whole spectrum of just not being happy with your job or happy with where your life is, right? Like we want to move people into a place where they're actually thriving. And so in some ways, the definition doesn't matter so much. It's more, well, how are you doing? How is it working for you? Do you look forward to getting up in the morning and what your day looks like? Or do you meet it with dread?
That is so powerful, Dr. Diane. And I agree with you 100%. I know that for me, that emotional exhaustion piece was, oh my goodness, I could just remember just this overwhelming sense of fatigue that at first you start to question, is it your physical health? Like, what's going on? And it really is. It's an emotional exhaustion, which is different from fatigue. You just don't have it to give. Yeah. And I think as physicians, a lot of times, we think if we work a little harder, if we work longer, that we're going to beat the fatigue. Like somehow we're just going to catch up to it, or it's going to, eventually get better over time. And that's really not the case. Yeah. So, and I like what you said also about the spectrum, because I do think that, people kind of teeter somewhere along, the spectrum of being burnt out, like you said, to really thriving. And we want to just move people along and get them to the point where they do get to that happy ending, like there is a happy ending. So we want to make sure that you get there. So thank you for sharing that. I think that really is going to help a lot of people to understand, burnout and sort of where they are and where they need to eventually get to.
Yes.
Yeah. So when you look at then burnout in terms of things that we can actually, do about it, there's a lot of talk around, from an individual perspective, right? Self-care, the things that we can do to sort of help ourselves to overcome burnout. We know that there are system issues, and we know that those still exist and they have to be addressed. But for individuals, what can we do in terms of self-care? Like, what does that look like for someone who might be experiencing burnout, especially for, women in healthcare?
Yeah. Well, I think it's really important to start a little bit back before that, which is kind of, what does your life look like now? What do you value? Like, what are the pieces of your life that you really value? And how are you prioritizing those? And the pieces of your life that you value, number one, and also they're foundational to your feeling like your well is full. And so if that is time with your kids, or if it is running, or if it is, your spiritual life, your relationship with your spouse or partner, knowing that, and then clearly seeing that there are trade-offs. There are always trade-offs because we have finite energy and time. And so it's really bringing that to the awareness of, well, okay, Where are you choosing to spend your time? And often when you become aware of that and that becomes more intentional, you can begin to say no to things and set some prioritized or protected time for yourself for those things that are most foundational. And that's different for each person. For some people, I have to get enough sleep. For somebody else, it's I need to run, right?
Mm-hmm.
Or I need to take an exercise class, or
Right.
I need to, spend time with my kid reading at bedtime. So really knowing what those are. And then I think that's so important because the boundary setting and saying no to things is not easy, right? Whether that's the committee that you were just invited to join at work,
Right.
right? Or it's the extra activity for your kid that might just push you over the edge, like just be too much. So wherever it is, it's not easy, but it's easier if you know what your priorities are and you're really seeing that trade-off. I am saying no to this because this over here is really important to me.
Yeah, absolutely. I love that. And I agree with you 100% in terms of, self-care being individualized. It should be individualized because what's important to me may not be important to you. What I value, you may not value. So definitely it becomes important for us to make sure that we are choosing correctly, and we're choosing those things that bring us joy and help us to eventually move along that spectrum and get to the happy place.
Right.
Yeah. So that's great. So as we look at burnout in terms of women physicians, and obviously we talked about the statistics, we talked about the percentage of women experiencing burnout. But what really I think is heartbreaking is that we're leaving medicine, right? So we're leaving, the numbers are probably even higher now. When I look back at that study, it was 40%, but it might be even higher now, especially since we are, dealing right now with the pandemic. But so it's really heartbreaking, that women are leaving medicine early, or just going part-time or leaving medicine altogether. So it's really leaving a hole of really diverse, talented, women who could really be helping and serving their communities. So what do you think it takes for us to be able to turn that around, to be able to start to create an environment where women feel like they can stay, or at least that they feel like, their values matter, that, their priorities matter, and organizations can start to sort of support women in that?
Yeah. So first I'll talk from the organization standpoint, like what organizations need to do. And I think the first thing is they have to want to do that. And some of that might come from understanding the return on the investment.
Absolutely.
And you know what? As we are becoming more and more of the medical student population and moving through into practice, there are going to be more and more of us. And we know that there's a physician shortage coming.
Yes.
Right? In some places, it's already here. Organizations can't afford not to retain women physicians. So that's one. In terms of what they should do, really they need to begin with a paradigm shift, which is instead of kind of this sink or swim mentality, which in my opinion, which is what I've seen, is really to ask the question, what do we need to do to retain women physicians? And part of that is to go and ask them, right? What do you need? So it can be things that are, one of the things that came up so much in the interviews that I did was support around lactation when returning to work. Meaning not just a lactation room in the basement of the hospital where you can't get right in time, but actually having more support than that. And there's organizations now where they are giving paid breaks for women to go and to pump and come back, so that they're not losing their RVUs to be able to care for their family. And if you think about it, I love this example that someone told me about. You have a 2-career couple, a 2 MD couple, and they have a child. They're back at work after leave. The male physician is just gone off, he's had his regular day, whereas the mother is losing time to go pump. She's getting late in clinic, right? So she's getting dinged by whoever is in charge of the timing and her charts being finished, and her patients are upset because she's late, right? So she's got more charts to do at the end of the day, whereas his life hasn't changed. So if you think of it that way and think about, for this short period of time, relatively short in her career, if her organization supported her in a way that allowed her to more easily go through that transition of being a parent of young children, that makes total sense when you think of it that way. But it's also a longer term investment, which often I think organizations are thinking for the next quarter, not for the next 2 years or 5 years. So that's another part of the paradigm shift. So really, one of the best ways to do this is to shadow a physician, right? And whether that's a male physician or female, like going with them, sitting, seeing what their day looks like. That's what leaders can do to then be able to go back and plan interventions and changes in policy, and maybe even go to the board and present some of this to get some of those changes that would make life more doable for all clinicians.
Yes, absolutely. Absolutely. I love that. And I think at the end of the day, what we're really saying is that physicians just need to have their voices heard, right? So it's not enough just to kind of ask the question and just say, here, we gave it to you. You really need to hear the physician talk about what it is that they need and what it is that they want, and really have them be able to be a part of actually the solution as well, right?
Exactly.
Ask for my opinion, my input on how, it's best to serve me in terms of lactation. How is it best to serve me in terms of time off so I can be a better physician to my patients? So that becomes really important. I agree. Yes. So what 3 tips can you give our listeners in terms of how they can start, our women physicians, how they can start moving from a position of striving to thriving?
Well, one of them is based on something I said before, which is really to make those trade-offs more visible to themselves, because we make them every day. And the question is, are you making them in a way that supports you and serves you and your patients and all that you do, all the roles that you have? And to really remember, we all do better when we're working from a full well. So self-care is not selfish. It's actually recharging to be able to continue to give. I think it's really important for women physicians to be able to connect with other women physicians, to know that they are not doing it wrong. They're doing it right, and it's a challenge. And by raising their voices together, they can have more of an impact. And lastly, I think it's really about having the courage to model your values at work. And so if that means taking your vacation, or if it means, being truly off on the weekends without access, to do that.
Yes. Let's talk about number 3 for a little bit, please, because, I have run into this even with my own clients that I coach as well. And it's like, there's this fear of, showing up as either not committed, or that you're not going to be looked at as contributing 100% or as a team player if you take time off. And I think we have to start changing that mindset, because taking time off is important. And unless we start to, like you said, model our values, we don't then teach people how to treat us.
Exactly. And the truth is that all physicians, all clinicians need time off.
Absolutely.
Right? And so we're modeling this for others in the organization. And it's especially important to change the culture. That is how we change the culture.
Yes.
And I think there are specific things that you can advocate for. I mean, I know there's an organization that rethought their compensation package or their calculation so that it was based not on 52 weeks, but on 48 weeks, which meant that it was building in time for vacations.
Yes.
So you weren't losing RVUs if you took your vacation. So I think there are ways of, the organization can also support this culture change. That's one way. And it's also having leaders kind of be obvious about taking, vacation, taking time off, being off. I know one leader, a woman physician who in her email signature says, if you are reading this email and it's your time off, don't respond. Go and do what go and take care of yourself.
I'm giving you permission. That. Yes.
Exactly. So being in a leadership position, she is modeling what she's doing and what others can do.
Absolutely. Well, those are some really good tips, and I'm just going to just mention them again. So the first is to make sure that your trade-offs are visible. Mm-hmm. The second is to make sure that you're connecting, right, with other women physicians, because it becomes important for you to realize that you're not alone, and you can garner support from others who may be experiencing the same thing. And then the third is to make sure that you are that you have the courage, in terms of modeling your values at work, which to me just really just sent off, like a light bulb in my head, because I think that's just one of the things that we sometimes don't do. Yeah. So love those 3 tips, Dr. Diane. Thank you so much. So this has been a wonderful, wonderful podcast interview. Really excited that I had a chance to talk to you about this important topic. So I think it's going to help a lot of women, especially, again, since we are, again, in the throes of this, pandemic. A lot of our women physicians are on the front lines. And I just can't imagine, the stress right now that they're feeling, having to go through this period again. So I think this is definitely going to help them. So thank you again.
Thank you, Dr. Lisa.
Yes. So tell our audience where they can find you if you want to just share a gift with the audience at this time, and also just, tell them where they can find you.
Yes. Great. I want to mention first that the white paper that I wrote on the challenges that women physicians face is available to download on my website, which is dianeshannon.com. I'm also available, I'm also on LinkedIn, most active on LinkedIn, so you can find me there. And I forget what the other question was.
We're on social media. So you said LinkedIn. Do you have, okay, LinkedIn is where they can find you. Okay, great. Diane Shannon. Wonderful.
So, sorry, one more thing. I do want to mention, as a free gift, I offer a 30-minute complimentary coaching session where women can dive in and see, where are they now? What's going on? What would they like to be different? And to begin to notice what is the gap between where they are and where they want to be, and a few strategies to start making that change. And the sign up for that is also available on my website.
Okay, wonderful. Thank you so much for sharing your wisdom with us today. And I look forward to, obviously, speaking with you and us, working together in the future. So thank you again, and have a wonderful, wonderful rest of your day.
Thank you, Dr. Lisa.
Thank you for listening today and for allowing me to be a part of your career journey. To continue receiving leadership support, I invite you to join our private Facebook group, Building Women Physician Leaders, at www.leadingladiesincharge.com. Until next time, take care.